Hi friends, this is Dr. Ravi Kamapale. I'm an infectious disease, wound care and obesity medicine doctor in LaGrange, Georgia. I had to do a quick Facebook Live because this is something that I've been trying to advocate for quite some time in our clinical practice, where we are trying to help our patients improve on their metabolic health when they come with infectious disease problems. And I want to do a quick live video after taking the patient's permission. This being a diabetes month of diabetes awareness, and I wanted to bring this quick patient perspective on understanding the health and how the infection outcomes were improved, and also how the diabetes improved. Here we have a gentleman, a 67-year-old gentleman who has had a history of problems with his back pain. He ended up in a hospital after he had his car go off the ditch and fell down, and this happened around September 8th, 2025, and he ended up with hospitalization, literally with back pain, and which finally he did not give that history, and he ended up giving that history after the fact. But we found out his abscess, which we did everything on telemedicine, by the way, and we ended up helping the diagnosis of it and put him on IV antibiotic therapy, put a drain to take out the fluid in that, and diagnosed as him having Staph aureus abscess, put him on IV antibiotic therapy for a long time, till at least I think September 3rd he was on, from at least basically almost 4 weeks or so. He had been on IV antibiotic therapy, and he got better. But now the question is, what was going on with him was his problems with diabetes. So he did not have any pain, he did not have much of any sensation until we probed around to ask for it, repeat CAT scan, repeat orthopedic evaluations, and finally the drain was done and we got him back out. Now that the kicker here is how we got him to improve is by teaching him his metabolic health. He was on insulin, and he was having this glycemic up and down, and he was very depressed, and was thinking that he was having problems, and he had to be on the insulin for a long time, and he was not feeling himself. So we decided to teach him how to do his metabolic health optimization along with improvement of his dietary approaches, and we ended up teaching him how to do this, wherein we taught him how to track his blood sugar, and also taught him a dietary approach which involved low carb diet. Initially, when we started doing it, we also taught him to cut down his blood sugar by dietary approach, but also educated him about his chances of low glucose levels, and also asked him to work on his insulin and also avoid glucose stimulating oral intake of carbohydrates, and also started cutting down the insulin. And then also when he tried something that he was not supposed to eat, his blood sugar went up. So at his home visits, we were able to see his blood sugar here. And also when he came for his IV antibiotics, as we were doing it, we were monitoring his sugars. Now he's only taking as needed PRN insulin, only occasionally, and he's on metformin. So this is Timothy, and so he has agreed to discuss and give a patient's perspective on it. Timothy, tell me about you, my friend.
Well, I'm 67. Had worked my whole life as a mechanic and that. And like I said, when I rolled that car, I didn't think nothing of it. A little bit of pain, nothing bad. Then it progressively got worse. Like I said, till where I could hardly walk. And that's when we got to the hospital, and you guys took and looked me all over, and you guys found that abscess. And when you got that drained, that was great. A lot of the pain went away. But my sugar had went up to over 409. So they took and you got me on the insulin, you got me going with that, and I was just tired of taking insulin shots and that. And you recommended, let's try this diet. Low carb diet, no sugar. Let's try it. And we did it. And I tell you what, my sugar, I quit taking the insulin. I do take the metformin, but ever since then, my sugar level's been right about even, around the 100 area. Don't feel tired, don't feel wore out. I feel great. And I just keep on watching my carbs, watching the sugars, as long as I don't overdo it. But when I do check my finger, if it's up a little bit, I know what I did is I took and ate something that I shouldn't have, which had maybe a little more carb in it, or just a touch more sugar than what it should have. And I correct it, and it comes right back down. I have no problem with it. And like I said, I don't take any more insulin at all. And
so what difficulties did you have during this course of a dietary change?
Just getting used to not eating potatoes, rice, breads, a lot of the things that you're normally brought up on. See, my dad was a meat and potato guy, and that's all we had, meat and potatoes every meal. Well, I started cutting all that out. Thought, oh, God's going to kill me. But I like salads. I like the fresh meat or meats and stuff. And so my wife makes it, and we do a good job. And she makes some delicious meals that are low carb, no sugar, and I don't miss that at all. And I'm feeling a whole lot better. I'm almost back to myself.
Wow. So, I mean, like, tell me about your low blood sugars.
You do every now and then get a low blood sugar. You start to feel a little wore out. So what I do, I got some little candies. I just take one. And that
But I gave you a list of hypoglycemia foods, though.
Yeah.
So, but and we explained to you about not just the glucose toxicity. I explained to you about your insulin toxicity, and I gave you the hypoglycemia foods. Those are the things that you have to eat or have.
Yes.
And let me ask you, what was your highest weight when what you remember of?
Oh, my highest weight was 280.
280.
Yeah.
And then when did they diagnose you with diabetes?
They told me a couple of years ago that I was borderline.
Okay.
But I was taking the metformin, and I just didn't feel good, so I quit taking it, and I just kind of watched my sugar intake. Didn't know about the carbs, but I was just watching my sugar. Well, like I said, then when I got sick this last time, and you told me the carbs is the main thing too.
Yeah.
Carbs and sugar. So once I got the carbs out, I feel great.
So what was your pain point during this whole journey of, since the diabetes? What did they tell you about insulin, and what did they tell you that you have to be on it for how long and all that?
They did not. They just told me I'd be on it probably for the rest of my life.
And now, are you happy that?
Oh, I'm happy I'm not on it. Oh goodness. I still have to check my blood sugar every day.
Yeah.
3 times a day, which I can live with that.
Yeah.
And that way I know where I sit. And like I said, I've been staying pretty level, and
you're able to do your
work, do everything I can do,
and you feel happy.
And I feel good. Feel real good.
Yeah, and you don't smoke or anything.
Nope.
You just have some degenerative disc disease, and that's what we're dealing with.
Yes, that's what I'm dealing with right now. But that's just because of my age and what I used to do.
But how old do you think you feel? You feel?
Right now, I feel like I'm in my 40s or 50s.
And how young are you?
67.
Yeah.
But I feel that too with my back.
Yeah.
If it wasn't for the back,
okay,
I feel great.
We'll get that fixed. Don't worry about it. And what would you say you would advise somebody in your scenario?
I would do like what you told me to do. Get on that keto diet with low carbs, no sugars. Stick with it. Don't vary from it. Just stay right on it. At first, it's kind of hard because you're giving up a lot of the things you're used to eating, which you didn't realize are bad for you. But once you get rid of them, I've got no sugar. My wife makes cookies and stuff for people at work. It doesn't bother me. I can sit there and watch her make cookies, smell the sweetness. Does not bother me. I have to have it. Matter of fact, sometimes it's like it makes me a little nauseated to smell it now because I haven't had it.
Yeah.
Drink lots of water, which I've been doing. I mean, I've been happy, pleased with what the results have been.
Yeah. So, any last advice you want to give people?
Listen to your doctor. Don't be like me. I was stubborn. I didn't listen to my doctor, and it almost killed me.
Yeah.
So you've got to listen to your doctor. If they tell you that something, you do it.
But also understand that doctor might know certain things, but you know your body. Trust your body. You have to trust your body because you are the suffering person. When you have to seek guidance, you have to understand when something doesn't make sense, your body talks back to you. Yeah. So you got to listen to your body.
Listen to the body. That's the
listen
thing.
to your body.
I try to not listen to it.
And you're happy that you have a good daughter who took care of you, who pushed you to go back to the hospital, and from there on.
My daughter and my wife both got on me about it. Told me to get in there to get seen.
Yeah. So
I came within a few days of possibly being dead.
Oh yeah, it was
infection.
Yeah, it was. Your case was a little bit troubling because I was taking care of you on telemedicine.
Yeah.
And I was doing everything on the remote, and then we were able to diagnose that abscess that we did not know. And by the way, he had Staph aureus bacteremia. We did not know the source. We were trying to figure out which the heart or the back, and we finally figured out the psoas abscess, which is kind of very hard to find, and we figured it out. And the beauty of his clinical situation is we have a body composition test. His initial weight in the past was high, and it is 210 now, but this was on October 7th, 2025, when we finally got to do this. But I think what we'll do is we'll do more body composition testing on him and show that this whole process where you see here the body fat mass. Once with the next test that I'm going to do, I'm going to post it on this the follow-up picture. I'm going to post it on there, where I'm going to show that if we do a good dietary approach, the body fat mass reduces, okay, and obviously the percent fat gets better, and the excess fat is also going to go down, and the visceral fat should go down. So I'll try to have him do that test today, a simple body composition bioimpedance test. And this is how we are trying to address healthcare and healthcare change. In this current scenario of healthcare, I would really, really, really urge every person suffering from metabolic ill health, that includes me, to understand what is going on and how are the needs of each human being. And the problem we have to address is not with a whole in a person approach and a whole person. So this gentleman had infection. We were addressing the infection, but also we tried to find the source of the infection. So the same way in people who have wounds, they have a small hole, but the problem is the whole problem is body composition. So what we are trying to do is develop a process where we use technology with telemedicine, with biomarkers, and also empowering solutions with high touch, wherein we are going to bring in technology that people can deliver care model with their professionals. So you need to involve your doctor. You cannot do this alone because you end up having problems with hypoglycemia. That might be an issue, or the infection and the wound not getting worse. So you're not getting better. So trying to understand your own metabolic health, and also understanding that food is majorly very important, with understanding that if you eat glucose, if you're diabetic, you don't have glucose toxicity only. You have glucose toxicity, which is a symptom of insulin toxicity. So you need to understand that glucose insulin toxicity with really lipotoxicity at the underlying aspect of it, which is driven by insulin as a lever, that is a master hormone that when stimulated too much stores the fat. And when you don't stimulate insulin, which is stimulated by high carb intake, which you reduce the high carb intake, your body knows how to fix it. So please seek guidance. Don't neglect the aspect of real care solutions that are out there, and trust your body. Seek help. Don't be giving up your health to doctors or anybody. It's your body. And the major problem in this whole process is the addiction to the food. So if you don't understand, seek guidance. There is a lot of information with internet out there, but please don't do it yourself. Seek guidance, seek help, and at the end of the day, also you have to understand it's all about biomarkers and tracking and trending. So what I teach my patients is to eat right food, fast, feast, and track. So without tracking, you cannot understand. So what we have is a process where we have a foot logging tool, and also we do blood tests, we do glucose monitoring and ketone monitoring. And when that data comes in, the biomarkers are good. So you can be anywhere in the world. We can help. The question is simple. Of course, there is a lot of legal aspects to it that I'm not talking that. I'm talking about from a biological aspect of care delivery model. This is not hard to do. It needs a little bit of education, little bit of the end suffering person wanting to do improve themselves. And this can be easily done. And all we have to do is develop a tool that has communication, personalization, realization, implementation, and reevaluation, which we have implemented as a platform-based approach in our clinic. And we are able to track the blood glucose, blood ketone, and also wound trending from the bear. And the people are far away and they can still take their pictures. That pictures come to me, and their blood sugar comes to me, their food comes to me, and we are developing the whole process of platform-based cost apart thinking. With then we're able to scale it for solutions that can be delivered for amputation prevention in USA and across the world, 1% at a time, moving away from mass medicine mindset to a power of one approach, which is going to happen in healthcare, and giving up is not an option. Please, on this Diabetes Awareness Month, let's take care of ourselves and the people we hope to help. Thank you very much. Thank you for giving the time. Timothy, thank you for taking the time and giving your time. Any final word?
Nope, you said it all. Just listen to your doctor.
Okay.
Just listen to him. I mean, like I said, if I hadn't done what he told me, I'd probably still be on insulin.
Thank you. So basically, what I want to finally also say is, if you really need some help, please help. Understand that there is resources out there. Obviously, a little bit of marketing, I guess, but this is my website, nobadbugs.com. Okay, and basically you can go to that, and we have the good-looking person there, and also obviously on the bottom of that we have some like lot of real stuff that we do on wound care, and lot of presentations on there. So I'm talking about learning yourself, like edification, and obviously there's a lot of YouTube links on there. You can go there and learn. But please do not take this as a personal advice. This is just a educational content that we are trying to develop, and please do not do it on your own. Seek help and hope everything works out for you. Take care. Thank you very much. Have a good day. Thank you, Timothy, for taking time.